This is the full citation of the study. It was published in the Journal of the National Cancer Institute back in August, but about 2 months ago it really hit the media news headlines. The purpose of this study by Brasky and fellow researchers was to find out if there was an association between prostate cancer and fatty acids such as omega-3 fatty acids, omega-6 fatty acids, trans fatty acids. Just some quick background facts about omega-3 fatty acids. If you've heard of essential fatty acids, those are the fatty acids that are essential. They include omega-3 and omega-6. Omega-3 in the form of fish oil is used to treat different medical conditions like triglycerides, coronary artery disease, and rheumatoid arthritis, and potentially other conditions that are being studied. Examples of omega-3 sources are shown here. Study methodology was this. Blood samples of almost 36,000 men without prostate cancer were stored at a very low temperature for many months. The blood was originally stored for another purpose as part of the SELECT trial. If patients self-reported prostate cancer at follow-up, their stored blood was tested for fatty acid. Matched patients also had their blood tested for fatty acid. Here is my take on the adequacy of the measures in this study. I feel that there was a robust study size. It was a good size. There were 834 self-reported cases of prostate cancer, and the comparison group was 1,393 subjects that were matched on some of the demographics. Comparison group did, however, have a lower baseline PSA level, which could have affected results. Also, another thing that could have affected results was cancer self-reports had higher education and income than comparison group, so they could have differed in some meaningful way. Cancer self-reports were potentially screened diagnosed sooner because prostate screening was not done inside of the study and was not mandatory, which would have made it a lot more of a valid study. The key measure of risk found received lots of media attention about 2 months ago. It stated that elevated omega-3 fatty acids were associated with higher risk of prostate cancer. The hazard ratio was 1.43, which implies a significant association, and dose response was seen, implies the measure of risk is even more convincing. The author states that the study, quote, replication strongly suggests that omega-3 polyunsaturated fatty acids do play a role in enhancing prostate tumorigenesis, end quote. However, correlation does not prove causation. I don't agree with the author's definition of elevated omega-3. The average omega-3 found in prostate cases was 4.66% of fatty acids was omega-3 in prostate cancer cases. In non-prostate cancer group, 4.48% of fatty acids was omega-3. That doesn't seem like a very big difference. I'm not convinced that it's decisively elevated compared to 4.48. The things I would change in this study are, first of all, I would use a much larger difference in the omega-3 level comparison instead of a tiny 4% difference between 4.66 and 4.48. I would also, secondly, improve matching so that the comparison group has the same baseline PSA instead of having lower PSA at original lab work. Number 3, I would check the cancer cases and make sure they're not more health conscious and therefore screen diagnosed sooner since prostate screening was not mandatory in the participants. The implications of the study are that if this controversial study is valid, then patients with prostate cancer risk may not be candidates for fish oil supplementation, and recommendations would need to be modified. If the study is valid, then the patients with elevated PSA, enlarged prostate, or family history of prostate cancer would be urged to weigh the benefits of fish oil versus prostate cancer. However, before we go there, a longitudinal study is clearly needed where fish oil consumers are compared to non-consumers, which was not the case in this study. And both groups screened equally for prostate cancer, which was not in this case either.